There is no benefit that should be prioritized over saving a life. We think that that helping to save lives with your already dead body is an act of honor, not disrespect. The government is only trying to save people in their society and help others. But we do concede that there are a few people in society who, regardless of this, don't want to donate their organs. Freedom of choice matters, but when it is not not when someone's life is on the line. The mandatory organ donation would stay consistent with the policy and status quo that organs should be taken after death. So you would have no use for these organs anyway, and therefore it can be used for a much greater purpose to save a life. Only healthy organs also would be taken. So if someone has a liver disease and died, then their heart would be donated and not their liver. First argument then, which is about the principal justification. The premise of this is that we do value people's freedom of choice to decide what they want to do to some extent with their dead bodies, but we prioritize the right to live over this freedom. The justification this is very simple. Note that millions of people are dying and really sick from organ failure. But when you are dead, you cannot experience the things that others in hospitals are forced to experience. Those who are donating organs have usually relatively healthy lifestyles, and therefore they're much more privileged. And then the ones that are about to die because of organ failure. We would favor someone's right to live that can be granted when someone's right to believe in a superstition or religious belief is deprioritized. The people who own their organs already passed away and are not going to get impacted at all when their organs are being donated for the good of the entire society on their as a whole. On opposition's comparative, we could have spared the lives of more people and their families' grief if we favored the right to live over a dead person's insistence in believing a religious superstition that may or may not be true. We think that our policy helps the organ shortages and status quo. We can see to the fact that parents will want to have their children's organ donated because they only care about their children. But know that whatever reason the parents have to not give away their children's organs is nothing comparing to letting someone else die. We think that the people who need these organs already have their own parents who wants their life to be saved. When there is one person that already has a very satisfactory and pleasant life to some extent, then that person should save the one who does indeed have a family who cares about them and who wants their child to live. With this policy, freedom of choice is degraded, but we have a better trade-off of saving someone else's life because of everyone with organ failure is going to be saved, since others are forced to do acts of honor and kindness that they don't recognize on their side because they are selfish individuals. Second argument then, which is about reducing inequalities. In status quo, there are existing inequalities between who can get access to organs or not because of existing organ shortages. Two layers of mechanism here. The current organ transplant system would favor wealthy individuals who can afford expensive private healthcare and travel to regions with high organ availability. A universal donation mandate could reduce the imbalance by prioritizing medical need over financial capacity. By removing the voluntary aspect of donation, everyone contributes to the system, and no single group disproportionately bears the burden or benefits unfairly because there are enough organs to be mandated in the mandated donor system. A mandatory global organ donation system could therefore create an international organ sharing network, which ensures that all organs are allocated based on urgency and medical compatibility rather than geographic location or economic resources as found in status quo. Marginalized groups are often experience higher rates of chronic or organ transplant needy illnesses, such as kidney or liver diseases, but have less access to donor organs. This is further exacerbated by social or systematic factors, such as limited access to healthcare or a lower chance of being prioritized on transplant lists. Even if the organ distribution process is not based on financial capital or other arbitrary factors, the entire system is facing such a big shortage that when the most urgent individuals gets the organ, the next person in line becomes urgent, and then the next, and then the next, which perpetuates a vicious cycle. In many societies, organ donation is disproportionately reliant on a small part of the population that it chooses to opt in. This creates an imbalance where altruistic individuals bear the burden of meeting the demand for transplants. Even if the default is set to opt in, there will be a disproportionate burden to those who opt in over those who choose to opt out when there are stressing a belief of a dead one compared to the life of a living person. Therefore, proud to propose.
Opposition advocates for a violation of individual liberty, the forced seizure of one's organs against their will. Bodily autonomy is a fundamental human right, and to compel individuals to donate their organs even after this is a grave infringement upon that right and a dangerous precedent for the state to set. So moving on to our rebuttals. Firstly, the government talks about how they prioritize the right to live over this freedom of choice. We think that we prioritize the people's right to live in an unoppressed society where organs are not forcefully taken out of someone's body. The government also talks about inequality. We think that with our alternative solution of developing international technology for artificial organs, we'd also be able to solve this problem without violating individual autonomy. The other points from side government will be the rebuttals will be integrated in our arguments. Moving on to our alternative solution, we'll have an opt-in system where we'll educate people and bring more awareness about organ donation, as well as fund more technology and to artificial organs to encourage people to live healthier lifestyles, which is the fundamental issue here. Moving on to our first argument on individual
Should
autonomy. We think that it's good for people to donate organs and morally praiseworthy, but to force everyone to donate our organs upon death violates the integrity and values of humans because it violates consent because you're not asking for their permission, right? But extracting their organs forcefully without their consent. This is problematic for two reasons. First, it destroys the human dignity for those who do not want to donate, but know they have to donate it upon death, right? We think that this destroys the happiness of their lives because people put as much meaning into their deaths as their lives, right? Secondly, there are people who are religious and impute a great sense of religious sanctity on their body. They require, according to their religious practices, that they preserve their body and hold to observe their religious rituals, right? Government's policy effectively oppresses religion and the faith individuals hold by destroying their bodies. We think that saving human lives is commendable, but it should not come at the cost of oppressing millions of religious people who have done nothing wrong to those who are sick, right? The impacts here are that, firstly, government is destroying the fabric of life for those whose religious salvation depends on bodily integrity. But secondly, they're also sacrificing religious minorities in order to keep themselves alive, which only creates more division and more hatred in this debate, right? Because the quality of life is determined by one's perspective and values of life, government is not saving more people if it's based on an oppressive system that makes life meaningless for so many people, right? When organs we also think that when organs are taken out of a dead person without their consent, there is also a lasting psychological impact on the family members who knew that their deceased loved one didn't want their organs ripped out of them, but still had their organs forcefully taken out of them without their consent, right? We think that it's the government's responsibility to keep people alive. So why should an individual have to be responsible, right? Even so, when technological advancements are there and the government can take responsibility, we think that's the right thing to do instead of forcing people to violate their own rights. Moving on to our second argument, we think that this worsens the healthcare system and public health. We acknowledge that not every health problem that necessitates an organ transplant is one's own fault, but a significant reason that is the majority is indeed because of poor lifestyle choices, right? Instead of encouraging people to take responsibility for their health by encouraging them to eat healthier, exercise, side government creates an illusion of solvency that I can get an organ easily from someone else, so I can engage in unhealthy lifestyles, right? This moral hazard means that the government may exacerbate unhealthy practices. This is because, firstly, it pushes the burden of health responsibility on actors who are living responsible lives, right? This means they're not doing anything wrong. They're living healthily, but they still have to have the burden of health responsibility. Second, it worsens the public health by thinking they don't have to pay for their health choices, right? Now that they think that, oh, they're like, it's mandatory to donate organs, so I can just do anything, right? I can smoke whatever because I have a replacement already. Thirdly, it creates mistrust in the healthcare system and therefore discourages the general populace from cooperating with public healthcare. This means that there will be more health problems for the general populace who will refuse to visit hospitals or adhere to their advice when needed. So proud
People
to
who are already
oppose.
dead and who are donating their organs did nothing wrong in the society, but also note that these people who are desperate to live and who are dying of severe organ failure also did nothing wrong. On responses, firstly, they claim bodily autonomy and freedom of choices. Two layers of responses to this point. Firstly, we only recognize these rights or any other rights for people who are alive as a social contract so that we can create a functioning society where people respect each other and have mutual agreements to let them decide their own lives. There is no reason why the same thing should apply to someone who is dead and cannot even understand the concept of rights as they're not conscious. Again, it would literally not impact them as they would have all the same freedoms in their own lives, and this is only after they're dead when they have no use for their organs at all. But secondly, even if we were to respect these rights to some extent, we would much rather not have other people dying because of the organ shortage. So just on this metric, just on the metric of severity and us actually having concrete benefits and tangible benefits, we would outweigh this point. They also talk about an opt-in system, but however, note that there is already an opt-in system in society and in status quo where people can know the benefits of donating organs and people can know that they can opt in. However, people choose not to. Why? Because the other side literally also says that many people don't want to do this because they might have religious beliefs or other superstitions. Because of these reasons, people in status quo are choosing not to donate their organs, which is why we would not respect these choices after they're dead, because there are much more important priorities in society. society. Then they also made a minor point about developing artificial organs. But firstly, note that this was just an one-liner where they did not provide any mechanization whatsoever, so we don't know how this is going to happen. But secondly, also note that since these systems are not currently developed or being used as a good alternative in status quo, it is completely unlikely how they would even get the funding for this, or how they would even develop this, or how like this would be able to supply the massive demand of organs, especially for people who cannot afford to literally develop artificial organs. Then the last point is on an illusion of solvency, where people would engage in unhealthy practices. But note that this is symmetric on their side. Artificial organs would give people the same idea that they can engage in unhealthy practices and they can literally just solve this problem again with artificial organs. Or if this is not true, then we would just posit that no one would want to have liver failure, want to experience extreme pain, and then want to go through a severe surgery where their body is cut in half and sewed back together again, just so that they can do some unhealthy habits or eat junk food to the point of literally having an organ fail, just because you can get surgery later or you can get another organ later. Then now moving on to our third argument on increased regulation. So premise, status quo, there's an urgent shortage of organs for many people with diseased organs, and because of some people's superstitions, irrational fears, there's not a sufficient amount of volunteers who choose to opt in when this is not legally required. This leads to illegal organ trades being quite prominent, which is regulated and run by criminals rather than legitimate authorities. Not only is this still limited and not existing in every place, which means that there's still a severe shortage, even if because not everyone wants to opt into a criminal system such as this, or might not even have access to it, which is why arguments from our first speaker still stand. For people that do still choose to opt in as a desperate last resort to prevent dying, they still face significant risks, like the lack of regulation, meaning that people who are desperate can be directly exploited by facing information asymmetry and being told a certain organ is in good condition when it's not, by being financially exploited and having no choice but to pay exorbitantly large amounts of money, or even being completely scammed and forced to pay upfront without even receiving care, or not being able to have adequate medical care, as again, there are no standards whatsoever and no credible medical professionals that want to be involved in this illegal activity, meaning that the risk of people requiring organs might not being compatible with the organs they receive or facing other side effects can be increasingly common. This happens not only because there are desperate people with no other choice that can be manipulated, but also, as since this is an illegal trade, the people running this know the victims of exploitation cannot seek help from authorities without admitting that they were involved as well, effectively trapping them. So when the current volunteer systems are insufficient to match demand with supply, we must require organ donation to not only provide people with more organs, but also a better quality of care. We're able to do this by making this a government policy, setting regulations and restrictions that prevent exploitation. And as a result, not only will people requiring organs be able to have a safer alternative to organ trading where they're actually protected because of the increased supply of available organs, this trade itself is also likely to die out, permanently removing these harms. As the government, it is their responsibility to support these vulnerable people, not fail them, not turn their backs, to prioritize instead the superstitions and freedom and choice of a dead person rather than the lives of innocent
It's not an individual's fault for another individual's bad eating habits or unhealthy habits. I'll prove to you why today our team wins. Moving on to rebuttals. While mandatory organ donations, while it could increase the supply of organs, it doesn't necessarily solve the problem of organ shortages. The real issue lies in improving the transplant process, actually funding the medical research and not just forcing donations. Even so, our case is better. Organ donations should actually remain voluntary so that people are motivated by desire to help others, leading to a more ethical and genuine donation. A system simply built on voluntary donations actually can still improve the organ supply without infringing on these on personal freedom. Our side, we actually encourage education and awareness that can boost the voluntary donations, which have been effective in many countries with high donation rates, like Spain. Voluntary donation programs are more sustainable and give more trust, resulting in a higher quality donations. On our countries with voluntary systems has seen significant increases in organ donation rates, showing that trust and education work better than mandatory policies. A more ethical approach to actually increasing the organ donations, which will ultimately lead to a greater success under our world. Mandatory organ donations may create a sense of fairness, but disregards the personal autonomy and cultural or religious beliefs. Equality in access to organs should not come at the cost of individuals' right and freedom of choice, whether they are dead or not, as these are essential to maintaining a just society. If they are dead, could you just do anything to them? No, we think that their side can't do anything. Is simply infringing on these people's rights. If we are charitable and say that everything they say is true, a voluntary system can still ensure fairness by actually encouraging donation through education, incentives, and awareness campaigns, and improving the technology for artificial organs, which I will explain later on. People will be more likely to support the system when their rights are respected, and this leads to more ethical and sustainable donations. The principle of fairness is better maintained when individuals have the freedom to choose. A voluntary system just only just using strong education efforts can actually result in high donation rates without infringing on anyone's rights or belief, ensuring that more people have access to organs in an ethical way. Countries like with voluntary system like Spain has achieved high organ donation rates without violating personal freedom, showing that fairness can be achieved through choice rather than coercion, right? Judge, no one has an obligation to save others. It should be a choice to do so. The government does, but not the individual. We still encourage people to donate. However, it's another individual's fault that that person is sick in the first place. On our side, we will fund more technology into artificial organs and encourage people to live a healthier lifestyle, which is the root issue and which we solve. We think that we can solve this issue better than their side. Let's quickly rebuild our first argument. They say it doesn't matter because they are dead in the first place, right? I think that's incredibly unethical. They'd rather save another person. I think that this discards the psychological impact on families who will feel robbed. While the religious individuals can't feel it, the families will be disregarded in the first place. We think that their side violates the integrity and values of the human because it violates the societal consent as one is not even asking for permission. Judge, I cannot emphasize enough as prop never seems to listen. I think that it's no one's fault for another person's bad health. They clearly ignore how we would educate these people to live a healthier lifestyle in the first place. Educating the public about the importance of organ donation can help reduce the misconceptions and actually build more trust. When people understand the impact of their choices, they're more likely to donate voluntarily. Obviously, we will also fund more on the organ transplant. So their third argument simply does not stand. Focus on education and technology actually respects the individual autonomy and ensures that it is more sustainable. Third argument, mistrust in the medical system. Making organ donors mandatory would lead to distrust in the healthcare system, as people might fear that doctors might prioritize organ harvesting over saving lives. This could make individuals hesitate to seek medical care or avoid the treatment as all, which would harm both their health and public trust in the healthcare institutions. It also takes away the right to choose what happens to your body after. That's something many people feel strongly about due to their cultural and religious beliefs.
Moral obligation to protect human life, prioritizing it over any other right, because we have a potential to save the life and not spend thousands in making a new artificial organ that is both inaccessible and unrealistic. Quickly moving on to rebuttals and clarifications. It is inconsistent that side opposition claims that not enough people would easily opt in on their side to fulfill the huge demand of organs, which is not happening in status quo, simply with education raising awareness, but that they would feel as though their rights are violated when they have to donate on our side. This means that if people are consistently coerced into opting in for donating organs because that is the narrative that they propose, then this would mean that there's already somewhat near to an alternative that we propose. And if they think that education can change someone's entire worldview, they could do this well on teaching people why mandatory donation is a necessary policy that exists, and hence we reject this clarification. But moving on to the two main questions of today's debate. First question is, which right should take precedence, the right to live or right to free choice? This right to live holds precedence over any other kind of right, especially one of a dead being choosing to exercise their right of belief or whatnot. When one's personal free choice not to donate because of whatever belief presents another one from living, the right to live should take precedence, obviously, because even if they feel like they have some kind of religious barrier and they should be protected like as they are when they die, if we're able to save one new person, we think that it's worth actually risking that right. And I will explain this later why their alternatives are not feasible as well. But implementing mandatory organ donation policies can also save lives immediately by increasing the availability of organs, which is quicker and more accessible compared to any other alternative that opposition bench mentions. If a mandatory organ donation system could prevent thousands of deaths annually, we argue that this justifies limiting personal choice for the greater good of society. If we're able to save thousands of more people just by ensuring that they don't ensuring that everyone has to opt in, then we think it's much better. Now let's move on to the more fundamental question: which alternative holds more feasibility? Imagine this: if we can save the life of a boy who had no choice but to eat fast food because they could not afford a nutritious meal by rich poor disparities, we don't think it's necessarily his fault that his organ decided to fail, right? And opposition cannot just simply say, oh, it's his fault in the first place. Existing medical infrastructure can be optimized for organ transplantation instead of creating entirely new technologies in order to create artificial organs, which would both be inaccessible for the poor socioeconomic classes. Creating artificial organs requires very advanced technology development and facilities, which are not only highly expensive, that make
make it harder for lower socioeconomic classes to easily access. Instead, we tell you that there are organs that are readily available for us that can be taken, as we already proved this in the first question of the debate. But developing and using artificial organ takes years of research, then trials, then official approvals before they can be widely used and implemented as a feasible alternative, and another tens and thousands of years before they can be widely afforded by lower socioeconomic class people, and hence this does not really solve the problem, which, like DPM said, forces them to turn into illegal or illicit alternatives such as organ trafficking or organ trading that happens in the dark web that are also unethical and unsafe, which is no different from status quo, as the current regulations limit the number of organs available because of the same problem. In status quo, the primary reason why organs are so expensive and the poor people cannot afford it is because the number is limited and there's an organ shortage, and the same would go for artificial organs, and this doesn't really necessarily solve the problem that we propose. The conclusion to be made is that opposition fails to account for stakeholders, a critical one in status quo, which is the lower socioeconomic class individuals. Since they don't resolve this, but spend thousands more in helping rich people get artificial organs, they don't solve part of the bigger issue, but also they rule a personal freedom of a dead person because they feel like their body should be preserved as it is when they're dead over the right to live. Meaning, like I said, there is no reason to do this. If the person is dead and no one will care, it's okay to rule this right over any other right, because the right to live. Imagine a child has the child's right to live is obviously much more important than one's belief, and a religious belief at that, when they just want their body to be preserved as it is. We feel like the right to live should take precedence, and for these reasons, so proud of
organs distribution can be achieved on both sides. We think autonomy should be prioritized. They failed to prove how artificial organs will not be the same, and they failed to prove why autonomy is super not important and the lives are more important when it can be achieved on both sides. First question, which side helps the donor more? They see principle justification. They say we need to prioritize their right to live. We think this is wrong in three ways. Firstly, nobody, as we already said, nobody has the obligation to save others. There should be a choice. A person's bad choices does not mean another person's autonomy should be violated. It's good to save others, and we want to encourage that. So, but it is not the donor's fault that the person is sick. It's not fair for the person who made good health choices and lived a healthy life. Yes, there are some instances where people just get organ failure for no reason, and that is why we think people have the option to give and donate their organ. That's why we also have artificial organs that the government can make and that can donate, simply because that's the government and that's their duty, which is to take responsibility about their own citizens by doing something like making artificial organs, using their money, or being as international as a whole, and collaborating to make artificial organs to spread it across everywhere. We think because it's the government's their responsibility, that's why it's justified, not like we're us forcing someone's autonomy just for them to donate organs, right? Secondly, we think it's wrong to prioritize the ones that deserve to live. Why? They did stupid things most of the time. If they didn't, they still have an option. We think there's a limited amount. You see, all this happens with technological organs. Sure, it does, but at least people's autonomy is not violated. Also, at least another person not being violated for another person's bad action. Technology doesn't do anything bad to anyone, because at least the person's like religious rituals or superstition are preserved. Even if we concede to everything they say and stay, it still happens on our side. If we concede that all their harms on our side is also on our side, the exclusive benefit we have still is the protection of minorities and autonomies. We think lastly, it actually does impact these people autonomy, right? This decision impairs people's right to self-autonomy and actualization while they're told that their organs will be harvested upon death. So the impacts last while they are alive, and people will be furious and miserable. People will really care, and religious people or people who simply don't want to see their parents' body being donated away to other people, those should be prioritized because simply they did nothing wrong. I'll take up your line.
Yes, but because of alternatives like your bench proposed, like artificial organs that are inaccessible for the lower socioeconomic class, if people just say, oh, not my problem, and abandon this, these poor people have to turn to illicit alternatives. How will you prevent this?
Firstly, I don't think you guys are getting our stance. With governments and other governments, we're cooperating to make free organ and artificial donations to give to these people. Also, we have the opt-in policy that allows some people who want to donate and want to help to society. We think those people can also donate organs, and we still will match like the missing organs that people need with using artificial organs. Second clash, which side actually helps other people? They see like it favors wealthy individuals, like reduce imbalance international, how like they can be be good internationally, right? We think technology exists and will continue to advance after we fund technology and make it cheaper for everyone. Making this AI, they can make like artificial organs for a very, very cheap price. Yes, it might lead to unhealthy decisions, but it also happens on your side no matter what. We think it'll be the same price with the same amount of resources because it's a government's obligation. We think they can take like specific measures. We think everything will be the same no matter what, no matter the organ donated, and it will help the person anyway. So all the prop arguments we think is on our side, but what prop doesn't have is the person's personal autonomy, right? We prioritize the minority and their beliefs. We see no ways is why this is necessary. We're willing to give a trade-off for we're willing to give the trade-off for like for them to have artificial organs. We still think that there's also people who opt in. We also think that that the reason and the way they make artificial organs is like they charge nothing and donate it from tax money and whatnot. We already fleshed it out from for our stance. It's a really insufficiency. We think it's easy enough to make artificial organs through technological advancements and how AI is becoming super, super powerful. We think through collaboration,
We
this is
think that
possible.
it destroys the human dignity for those who do not want to donate, but they know that they'll have to donate it upon death. We think that this destroys the happiness of their lives because people put as much meaning into their deaths as their lives, right? Moving into the first issue in this debate, does autonomy matter in death? So side government claims that it doesn't matter because they're dead. But the point here is that one's death is connected with their life, right? That is to say, this decision impairs people's right to self-autonomy and actualization while they are alive, because they will be told that their organs will be harvested upon death, right? So the impacts last while they are alive, and people will be furious and miserable. We think that government's policy effectively oppresses religion as well and the faith individuals hold by destroying their bodies. We think that human lives is commendable, but it should not come at the cost of oppressing millions of religious people who have done nothing wrong to those who are sick, right? We think that it's the government's responsibility to keep people alive. So why should an individual have to be responsible, right? We think that when our alternative solution raises awareness and advocates for social voluntary donation out of a want to help, as well as funding technological advancements for artificial organs and encourage a healthier lifestyle overall, we think that we can save lives as well, with the exclusive benefit on our side being that we're not violating people's rights and bodily autonomy without consent. Moving into the second issue in this debate, which side is better for others. So side government talks about how they can save people with organ donation. We're saying that we can do the same thing because we know that AI and technology is growing every day. We know that there's like countless medical like centers and like government organizations that research AI and like technology, and we know that we have the capability to reach a technology that can create artificial organs that can actually help people without violating others' autonomy. We think that due to these reasons, we take this debate home.
The side opposition cares so much about the rights of a person who is not alive, but not the right to life of a person who is. First, metrics. They claim that we should prioritize someone's freedom of choice, but never clarify why this should be. On our side, we have clarified several times why the right to life always takes precedence over any other. First, we would posit that thousands of deaths is much more harmful than any harm someone could get from knowing that they won't be able to do what they want with their body after they die, simply on the actual tangible impact, and also because people already do not have bodily autonomy after they die, as they're not conscious and quite literally cannot control their body or even know what happens to it. But secondly, they say that it is not the donor's fault on why someone is sick, but we would then say that it's not the fault of the people that are sick, either as in the majority of cases, this is because of either things they can't control at all, like genetics or whatnot, but furthermore, they claim that they will make artificial organs free, making the technology for artificial organs takes years of continuous development and trials, as well as implementation. Tax money is not enough to fund this, which we know because it's not happening in status quo. If it was such a perfect solution, it would be happening, and hence does not eliminate the root problem. There's no reason to use taxpayers' money when we have organs readily available with a justified reason to use that they never responded to, rather than just insisting the same thing over and over. But also, this is a very time-sensitive problem where people are currently on wait lists where they will die in months or even years, and we don't think that we should go through years of trialing and testing just because one person or like many people in status quo have random superstitions. But then on this point, if we look at which side can better actually support these vulnerable people, that opposition gives you two main points. Firstly, on illusion of solvency, we don't think anyone would purposely only eat junk food food or whatnot because they see having a major surgery and cutting their body in half as the easy way out. But if this is true, then it's symmetric on their side as well, where people would just use the artificial organs as an easy way out, as we mentioned in deputy. And secondly, on distrust in the system, they literally do not mechanize and they later drop this point. So we would say it's not even an important point that they're trying to prove. On our side, however, we prove that not only do we provide people with organs, which should be the main priority, but we also provide people with a better quality of care by eliminating the illegal organ trade, which is not responded to at all, even after being extended in a whip, showing all of the harms of this, such as people literally being exploited and failed by the government against stand. There are people dead and there are people dying. Instead of using tax money, we use organs that are ready. Thank you.